For many of us, it is the most important commitment to take care of our loved ones. We feed, as the Beatles song goes, and we work hard to ensure that those close to us are thriving. Today, there are 53 million people taking care of their parents, neighbors, and friends. And there are 53 million stories. From the Stanford Center on Longevity, this is When I'm 64, the podcast for caregivers. I'm your host, Ken Stern. Just over a year ago, the World Health Organization declared the coronavirus a pandemic.
COVID-19 cases in more than 100 other countries are rising. Here in the U.S., 1,000 people are now confirmed with the virus. At least 30 have died.
In the U.S., those first reported cases were on the West Coast, and they were soon followed by a larger outbreak in New York.
Medical staff have been describing war-like conditions in hospitals.
Since then, we've learned so much about the virus. We now know how it's transmitted, how to wear our masks, how to sanitize our hands, how far apart to stand. But what have we learned about the challenges facing caregivers? Have we come up with a better way to reduce the stress of caregiving? How have we handled supporting caregivers who are struggling to balance work and family obligations? Have we harnessed technologies to help support the critical work of caregiving? And how about better ways to give caregivers a break? Today we check in with 3 caregivers we met on the podcast this year who share what they've learned after 1 year of caregiving during the time of COVID. And then we meet some caregiving experts who will help us put it all in perspective.
This is John Stagliano. My parents ended up having COVID back in February, March of 2020. So my father got it first, and he got it pretty bad. Unfortunately, they wanted him to go to the hospital, and he didn't want to go. So they had to send him some equipment to the house for oxygen and so forth. And they had meetings with him over the site that they had set up where they could monitor his vitals and talk to him, and they did that 3 times a day. Eventually, they got through it. That they were extremely tired, and I guess maybe they're still a little bit tired. We still don't get together as much as we used to, so their normal socializing is really kept to a minimum, and I think that's the hardest part for them. It is sometimes difficult to keep that balance so you can keep your sanity. You know, I learned an awful lot by actually going through it with the both of them, and then my wife getting it as well. So it's just hard. I know that the protocol for being a caregiver was kind of a difficult task to come up with the correct procedures for. That's the hardest thing, is to try and figure out how and what you're going to do to take care of them without putting yourself at risk.
I'm Danny Klein-Modisette, and I have a company called Laughter on Call, which was created for my mother, essentially, who was depressed after an Alzheimer's diagnosis, and I wanted to make her laugh, and I was a comedian myself, but I couldn't do it because I was also her daughter. And so I had the idea to hire a professional comedian to cheer her up, and I did, and it changed the quality of the end of her life. And so I started a company where we bring comedians to people who are isolated and feeling isolated. And of course, interestingly, a year ago when COVID hit, obviously we could no longer get to our seniors, but the whole world became isolated. My father-in-law also has Alzheimer's, and he has been living in a residential community since before COVID started. And it's been very, very difficult. And we've tried all kinds of things, sending him magazines. We tried to get a telephone put in his room, but they couldn't get the service people in to install the phone. So it's been really, really super duper challenging. They do allow visits, but he is like, you have to schedule a visit. He is hard of hearing. So the combination of being outside, the mask, the plastic shield, it's almost impossible to communicate with him. No one anticipated that we were going to have a pandemic. So they were not prepared to figure out visitation in a more humane and connected way. It's not that it wasn't humane, it's that it wasn't like possible to connect. And I think it's been really detrimental to people, particularly in cognitive decline, not to have those touchstones of familiar faces at all. So it's been a super big challenge. I think they'll never be as unprepared again, because at least now they have systems in place where you get tested. When you go there, they take your temperature, they give you gloves, they have a system. But it took a while for them to get there. What I think is really interesting about this time, and having lived through this time and working in the senior world during this time, is that it really confirmed what we always believed in. And I say we, Laughter on Call, but I mean me, frankly. I knew that the personal connection was so valuable. And this has just really borne that out.
My name's Kitty Isley, and I am the caregiver for my dad, Al, who is 84, going on 85, and has very advanced heart failure. And I've been living with him and pretty much his caregiver for the last 3 years, for a long time now. So some of the things that have been way more challenging doing this because of COVID, a lot of them are logistical. A hard thing now is that we're in a hospice situation. That could go on for a while. But many of the people coming here to help us keep him at home aren't necessarily getting vaccinated. And so I don't feel entirely safe, and I have to kind of just zip it and deal with it. Even though we're getting good care, we get a lot of different people that come in to help with bathing or deliver supplies or check on his vitals or do whatever it is that hospice needs to do. And we're not able to be sure that they are getting vaccinated. And according to our nurse, the main hospice nurse, she's not sure either. That's meant we can't really send Dad to any sort of short-term, what they call respite care, for myself and our caregiver, just to kind of get a break. The biggest problem is that he can't stand up or walk anymore. So it is a big production to move him from a wheelchair to a dining room easy chair, where he spends most of the day, and then back to bed. Another thing that's made COVID, I think, really hard for people, either as caregivers or as people being cared for, is the isolation. I have really noticed it. People can't come over and just say hello. I've kind of let a few people come in the house when they've brought over food or come to see my dad when they've been pretty masked up, but he can't hear very well. So when they're speaking to him from, a safe distance, he can't read their lips. Mask covers their mouth. It's not a very satisfying thing, even though we're trying. So that has locked down our lives to basically myself, our caregiver, and my dad. And then when she can, my sister. But I guess you do your best. And I know I should be way more grateful. And I am grateful that we've gotten this far with nothing traumatic. I mean, so many people in this country have lived through traumatic loss this year because they're caring for someone who's infirm and is not safe, or was in an assisted living facility that got sick and died. And I know many, many people who've tried so hard to take care of their loved ones or are caregivers, in institutional settings, who are doing their best. But, when it's one-on-one and you can't lift someone and you can't move them and you can't get them clean, and you have strangers coming in your house all the time to do bathing or medical stuff or evaluations or deliveries or setting up equipment, it just feels overwhelming.
We've just heard from John Stagliano, Danny Klein-Modisette, and Kitty Isley, who have helped take care of their parents this year. Now we're going to turn to 2 leaders in the field of caregiving to try and find some answers to the challenges that COVID has uncovered. Grace Whiting is President and Chief Executive Officer of the National Alliance for Caregivers, and Jennifer Olson is the Executive Director of the Rosalind Carter Institute for Caregivers. Grace Whiting, let's start with you. How different a world is it today than it was a year ago for those caring for their loved ones?
One thing I think is about the same is that sense of isolation in the sense of that we expect that caregivers are going to feel isolated. But what the pandemic has done is amplified that. So, so many of us are dealing with mental health issues related just to the collective grief of the pandemic, the change in our lifestyles, missed milestones like graduations and birthdays. And I think for caregivers, it's been particularly isolating because the pandemic has really exposed that divide between, how we treat people who need care and older adults and people of color and so on, and how we treat those who are caring for them.
And is it your sense that caregivers have been left out of the conversation for the last year as we focused on those who are struggling with the illness? Have we not paid enough attention to caregivers?
There's been more attention paid to caregivers, but I would say gatekeeping has become a bigger issue. The idea that we're just treating people like visitors, and so they don't need to be at the bedside or they don't need to be involved in decision making. That has gotten worse. On the flip side, I think when it comes to employment, particularly for white collar workers, from people who can work from home, there's been, I think, more attention paid to recognizing that caregiving is a normal part of our day-to-day lives.
So Jennifer, also, let me ask you sort of from the same context. It's a year in, a good time to sort of step back and assess the quality of challenges and quality of life facing American caregivers. What do you think has been the biggest challenge of this year? And what do you think has been the biggest success?
I think the biggest challenge has been the loss of a caregiver's abilities to access the services and supports, or even just the friendly interaction with their social network and other things. As Grace mentioned, the isolation has been critical, challenge across the board. And I do think that caregivers' issues maybe haven't been raised in a thoughtful way in the times of COVID. I would see caregivers as actually the key to our response to a pandemic. They can make sure that somebody gets to their appointments for their chronic conditions, but also if they're experiencing COVID symptoms, they're setting up those vaccination appointments and driving the person to that vaccine appointment. They're facilitating watching out for side effects or bringing someone home after their COVID hospital stay. And I just think that opportunity to call out the role that the caregiver has played, the family caregiver, has been a loss. On the other side, I think, as Grace said, the increased visibility in some ways of the story of the caregiver, the challenge and burden, the reality that there are caregivers amongst us in every aspect of our life who are also the police chief to the store clerk has really been a positive, and I hope is an opportunity for change.
So Jennifer, the Rosalind Carter Institute published a study last fall in the middle of all this called Caregivers in Crisis, Caregiving in the Time of COVID. Tell us about the study, what prompted you to do it, and what were sort of the key takeaways?
I think the study came from, we have a number of one-on-one caregiver coaching programs, and our coaches had been hearing about this increased stress, increased challenges, and a lack of available supports or some of the outlets that caregivers had not being available. And so we'd also been hearing about a variety of financial stressors and other lifestyle stressors. And we said, well, what is the true place of where caregivers are coming from and what's driving their challenges as a part of our population? The results are hard to read, but not surprising, that more than 4 out of 5 of the caregivers we spoke to talked about increased stress due to the pandemic, the lack of access to service supports, the inability to bring someone into their home to provide respite or to provide some services, and even just to have a family member stop by to provide that half-hour meal or laughter break.
So let me actually pick up one of those threads and ask you, Grace. The higher levels of stress and isolation was, I think, particularly strong among women caregivers, and there's been stories of more women having to leave the workforce because of caregiving responsibilities. Tell us what you think the consequences of the pandemic has been for women caregivers in general, and whether you think it snaps back after this is all over, which is hopefully light at the end of the tunnel.
I appreciate your optimism, Ken.
Yeah, I don't know if I feel that all the time, but for purposes of this conversation, let's be optimistic.
Light at the end of the tunnel. The story for women's really interesting. In addition to the work that RCI has done, there's been some studies from the University of Pittsburgh, University of Illinois, EMD Serrano, which has a multinational initiative known as Embracing Carers. And in all of those, women have been, shown in the data, at least, to have an increased caregiver strain. And we see people with kids who are saying, I can't do remote school and work. And because I'm a woman and I have maybe a lower income than my partner, I'm going to step out of the workforce. And the reality of that decision to step out of the workforce creates lifelong impact for women. It's not just the immediate loss of income, it's also the potential loss of future retirement income, Social Security, and I think from a long-term perspective, the ability to re-enter the workforce after you've been caring for someone. So I want to put on my optimism hat and say that we are evolving as a nation in the way we talk about this, but I do think it's going to be a challenge for women, particularly those that exited the workforce because they had so many care responsibilities.
So we heard earlier from Kitty Isley, who talked about her exhaustion this year. I mean, exhaustion sort of seems to be a theme of this conversation. And one of her particular challenges has been she can't bring in respite care. She can't bring her father has Alzheimer's, very much at risk. So that she has not felt comfortable bringing in substitute care. Tell us sort of your observations on sort of both the importance of respite care and the challenges of delivering it during the pandemic.
Respite care is one of the most unique elements of support for caregivers that we've seen, because I think caregivers who haven't yet experienced or utilized respite say, oh, I'm not comfortable with that for a variety of reasons, safety, especially during COVID being one of them, or I'm not comfortable with that because no one can take care of my loved one like I can. And then you speak to a caregiver who has utilized a respite service offering, and it's like they drank the proverbial Kool-Aid. They're like, I get this, why this mattered, why this made me show up better as a caregiver because I had that moment. So I think one of the things that we realize is there isn't just a need for respite, there's a need for kind of respite readiness, respite supportive services, so that both, if we go back to talking about employers understand why respite is valuable and how to introduce that when they're talking to a caregiving employee, so that caregiver support programs talk about respite early and often, so that family members encourage and talk about respite, all kind of nudging somebody towards utilizing that service. Now, the challenge is in a time like COVID, right? Respite in the way that we might think of it isn't available in the same ways, or there's some additional challenges. I think this has caused some approaches to innovation. We've seen some virtual respite offerings, mixed success on that. It's one thing to ask someone to sit in a Zoom call who has the ability to engage fully. It's a different challenge to ask someone with a cognitive impairment to sit in a Zoom conversation. So I don't know that that's the path forward for everyone. I think there's a question about, what is respite going to look like in the future, and what does that term mean? It's another one of these words that I think, kind of like caregiver, it isn't well used and understood, and policymakers have been hearing, oh, we need more respite. When you ask a caregiver, they're like, well, what is respite and how would it matter? We have a bigger education gap to deal with in a lot of ways.
Grace, let me ask you about telehealth. We heard earlier from John Stagliano, who cared for his parents, his 81-year-old parents, at a distance. They were living in the basement of they both had COVID and living in the basement of their house, weathering it out and getting most of their medical care through telehealth. Their life would not have been possible without advances in technology. What do you see happening in telehealth? And what do you think the healthcare system needs to, which has been reluctant around telehealth before this, needs to do to support better, more efficient care to help caregivers and their loved ones?
The best thing coming out of telehealth is the sense that we need to triage care and that there is a lot that can be handled at home. So some of the basic, general practice type healthcare needs, do I have a cold? Should I come into the doctor? Those kinds of things I think can be very effectively treated at home and save everyone a lot of time and also make people feel better. The challenge with telehealth, there's some structural challenges. For example, access to the internet. Not everyone has connectivity, and living in rural places where you may not have access to internet is a huge barrier for many people. I think health systems are still catching up in terms of making their services available on mobile phones beyond just your traditional desktop computer, although you certainly see some of them leading the way. And I think the other piece about telehealth is, to some degree, there's patient-doctor trust or conversations with a provider that are harder to have online. People tend to be distracted. Sometimes your physician may be running from call to call, and a lot of physicians are not necessarily comfortable using technology. So I think that makes it a little bit tricky because you may be on technology and using a video conferencing service or trying to log into a special patient portal to try to help your mom go through her visit, but then the physician doesn't really know how to use it or they don't like it, and that I think adds an extra layer of sort of anxiety that wasn't present. And also I think many of us are thinking, gosh, I didn't plan to go into life being like a TV star. And so if you're already intimidated by your healthcare provider, being on video doesn't help that.
So Jennifer, you're a doctor. What's your observations on telehealth?
I think there's opportunities for telehealth to help, especially the distant caregiver, the caregiver who lives 3 or 4 states or 3 or 4 hours away from the person they're caring for. Maybe that caregiver can't attend every doctor's appointment or nurse visit, and so they'll spend their time after the appointment calling both the parent, who was the patient in that encounter and hearing some parts of the story, and calling the care provider if they can get information and have all the right approvals in place to talk to that provider. Just imagine how much easier it would be if the caregiver could sit in that conversation with the care recipient, the patient, and with the provider, asking questions or prompting the nudge of saying to somebody, well, Mom, you said you couldn't sleep. Why don't you tell the doctor what that was about? Or listening to every bit of the doctor's orders, even if that means laying off the late night soda and the patient doesn't want to hear that. So I think there's an opportunity in how we think about telehealth being a benefit that is broader than the interaction between the patient and the provider.
So let me actually pick up one of those threads and ask you, Grace, if there's one thing you get to do or tell Congress to do or tell the administration to do, what would it be? What's the one thing that could really impact against this menu of policy, non-policy options? What was one thing that could really impact lives in a positive way?
That's a hard question because I have yeah. All the things. Yeah. What's so funny to me about caregiving is it really is not a Democrat or Republican issue, because even under the previous administration, 2 major pieces of caregiving legislation were passed: the Raise Family Caregivers Advisory Council and the expansion of the VA caregiver program to include veterans of all eras. So that's a huge expansion. So I have to give some credit to the fact that it's not that this is an issue with President Biden or President Trump or Republicans or Democrat, but it actually is something that people come together on. And I'm encouraged by that. If I could wave my wand, I would say, being a policy nerd, data drives policy. So one of the great things to do would be able to actually start capturing data on who is a caregiver when we're talking about the Medicare and Medicaid program, outside of these smaller programs like self-directed care waivers. because that would allow us to really understand how caregivers are a part of the healthcare system, and it would allow researchers a way to investigate how we can better protect the health of the caregiver themselves. To Jennifer's point, how can we, from a public health perspective, think of caregiving almost in some ways like unsupported caregiving is a risk factor for your health and wellness, and that's why you need support. In the same way that if you smoke, you need to be in a program about smoking cessation, or if you're overweight, you need to be in an exercise program, that we're thinking about caregiving can be a really great part of your life, but you need help to do that. And in order for that to happen, somebody needs to be noticing that you're doing it.
So pass the policy wand to Jennifer. What's your one thing that you would make Congress do? And it can't be get more data. That's the previous Jeannie took that.
I'm disappointed about not being able to use that because I'm strongly committed to data being key to our progress forward. But I guess the other thing I would think of is a clear path for insurers or providers to cover caregiver supports, either through billing codes or procedural codes, so that those services, since they're billable, can be delivered and covered by insurance. I also think a lot about Medicare Advantage programs that are expanding to offer services that align with other social determinants, so gym memberships and meal delivery and doctor's appointment, Uber rides, all of that. I think if we could consider how caregiver support could be included in those, again, expanding the regulatory framework so that if a caregiver needs mental health or coaching or counseling, or if a caregiver needs peer support or some other types of engagement, that's covered, and then it will be delivered.
So I know many of maybe all of our listeners are grateful for the work that both of you and your organizations have done over the past year and years. And probably recognize it as I do, this has probably been a very tough year to be advocates for caregivers in such a complicated and tenuous situation. But I want to ask sort of, can we end on sort of the positive notes? What have both of you have taken away from this year that gives you hope for caregiving and the fact that, and the hope that we can improve the lot of caregivers going forward?
I think for me, it's seeing caregivers as some of the most adaptable people in our day-to-day life. Caregivers have had to figure out, if they already had food delivered to their front door, they now have to get that done when everybody else in their neighborhood is trying to get that done. If caregivers have had to figure out how to handle a couple of small children and relative with dementia, they have navigated that road a lot of times and have figured out unique and valuable solutions. I think what I'd love to see is caregivers as more the superhero that they are than the struggling and challenged individual. Who wouldn't want a caregiver in your workforce or on your in a community group that you're part of? They're amazingly resilient, adaptable, multitaskers that can teach us all a lot.
I'm inspired by the fact that people are paying attention to caregiving, and that so many family caregivers who previously maybe weren't able to come to Washington to talk to their members of Congress or go to a conference to talk to a researcher now have access to those people and places that they didn't before, because people have recognized the need to make those spaces more accessible, more welcoming really to families. And then personally, I would say, as much as it's been tiring, it's been great to feel like I'm working on an issue that makes some small positive difference in the world. And so to be able to get up every day and say, even if I'm tired, how much more tired is that caregiver who's managing all this, and realizing that I'm trying to do my part to make it better. And to me, I think for a lot of people, COVID has sort of made us step back and refocus on what's important to us. It's important to be close to our friends and family and to do work that we care about and to feel like we're making a difference in the community and to recognize that we're all in it together. And one of the silver linings of COVID is really driving that home, that the people we love, that we take care of, when they get sick, and they take care of us when we get sick, that's really the focus of most of our lives when all that other stuff gets taken away.
That's Grace Whiting, President and CEO of the National Alliance for Caregivers, and Jennifer Olson, the Executive Director of the Rosalind Carter Institute for Caregivers. If you want to learn more about these great organizations, please visit their websites, caregiving.org and rosalindcarter.org. When I'm 64 is produced by Carrie Thompson and Ava Ahmadbegi. Special thanks for this episode goes out to all the caregivers who've generously shared their stories with us this year. Please like us on iTunes and leave us a review. You can find out more about us by visiting our website, longevity.stanford.edu. You've been listening to When I'm 64, the podcast for caregivers. Thanks for joining us. I'm your host, Ken Stern.